Hey everyone, happy 2011. Welcome to the Can Do Divas. I'm Gianna Franco.
And I'm Shasta Michaelis.
We all make New Year's resolutions. So how about make 2011 a year of giving? We're actually here to ask you a call to action, to become a bone marrow donor. Someone very close to us, my cousin's little boy, Jayden, who is 5 years old, suffers from leukemia, and is in need of a bone marrow transplant. That's where you come in.
That's right. We've done a lot of research. Obviously, this is very close to home with us with Jayden, but we've done a lot of research on the necessity for this and how important it is for people to be donors and how many people don't know about the program, have never considered this. It is more involved than a blood donor, but it's very important. We've been talking a couple of hours today over in Oakland, California, with a guy named Perry Bowens. He is from the National Marrow Donor Program, and he has given us a lot of information, which we are now going to give to you and maybe inspire you to become a donor, maybe for Jayden if you were a match, or for somebody else who really needs you.
There are a lot of people out there who are in need of bone marrow transplants. We would love for you to take this opportunity to listen to the next few minutes of what Perry has to say and see how easy it is to get tested.
When you join the registry today, you're going to do the cheek swab. And from that cheek swab, when it goes to the lab, it's going to give them the markers that they need, the antigen markers that they need. So your information we put into the registry where all the patient's information is already there. If you match somebody that's already in the registry, we'll give you a call in 4 to 6 weeks, and we'll tell you, that you've matched a patient. If you don't match a patient, you remain in the registry till age 61. At age 61, the computer will automatically drop you out, and that's because of bone density as we get older and FDA regulations. Okay. But now, say that you do match somebody that's already in the registry, and my daughter did. She matched right away. Oh, wow. But what they'll do is we'll give you a call, and we'll tell you that you've been identified as a perfect match, and they'll give you the patient's age, sex, and what disease they have. Rules of confidentiality prevents us from giving anything more than that. And we'll ask you if you wish to proceed. Hopefully you're going to say yes. And if you say yes, then the next step is that we'll have you go to a clinic or a hospital that's close to you. You don't travel in this program, or we try to keep the travel down to an absolute minimum. But we'll find a hospital that's close to you. You'll go there, and they'll take blood samples. It's less blood than if you go for a full physical, to your doctor. That blood is sent to where the patient is, and it will be mixed with the patient's blood to see if there's any rejection. If there's no rejection, we'll come back, give you a call, tell you the blood test was fine, do you wish to proceed? That's the second time you've heard that. And hopefully you'll say yes. If so, we'll send you back down to another hospital or clinic, and you'll have a full physical. Now that physical is to protect you and the patient. So when the test results come back from the physical, we'll give you a call. We'll say everything was fine with the physical. Do you wish to proceed? That's the third time you've heard that question, and that's the most important time.
Because that's it.
Because at that time, and once you say yes to that, up to that point, the patient doesn't know you exist.
I was going to ask that question. At what point do you bring in and say?
After that third time, after the physical, and you say you want to go forward, we notify the patient that we do have a match and we're ready to go to collection. Okay. Now, we come down to how do we collect the marrow? Okay, there's two ways that they collect the marrow. First way is what's called a traditional method. This is the one that you hear about and you normally hear about on TV, and they normally get it wrong on television. But it's you go into a hospital that does require an overnight stay in the hospital, and it is a surgical procedure. They offer you two types of anesthesia. You can either have what's considered a saddle block. You'd be numb from the waist down. You'd be fully awake listening to the doctors, no problem. Or you can have a general anesthesia and you'll be completely asleep. The procedure takes about an hour and a half, and you wake up and it's all over.
The second method of donation is called the PBSC donation. It's a non-surgical procedure that takes place at a blood center or outpatient hospital unit. For 5 days leading up to the donation, you'll be given injections of a drug called filgrastim. Your blood is then removed through a needle in one arm and passed through a machine that separates out the blood-forming cells.
The remaining blood is returned to you through the other arm. Your blood-forming cells are back to their normal levels within 4 to 6 weeks.
Samples today. The samples look like a giant Q-tip, and there's 4 of them, 2 to a packet. These packets are sterile, so we want to leave them in the packet until we're ready to use them, okay? And then we're going to take them out one at a time, and you're going to place the cotton tip halfway into your mouth, and then you're going to pull it away from your gums and teeth. You don't want to rub your gums or your teeth. You want to rub the inside of your cheek. And believe it or not, I always tell people about the cotton tip, because you will not believe how many people put the flag inside of their mouth.
Really?
Oh yeah, it happens.
Wow.
So we want to be sure to put the cotton tip in our mouth halfway, and then pull it away from your gums and teeth. And you don't have to twist it. Just rub it up and down as though you're brushing your teeth.
On your cheek.
And you want to rub up and down on each side, on the top and on the bottom and on the top. Okay, 1 Q-tip for each quadrant.
Okay.
So 1 Q-tip for the upper, you're brushing up and upper like that, and then 1 Q-tip for the bottom, and you're brushing like that.
Okay.
Okay.
Doesn't matter which side you start on?
No, doesn't matter what side you start on or what sequence.
Okay.
Now, once you're finished, the holder that you have here has 4 slots on it. Okay. What you want to do after you've done your swabbing, you want to take your little Q-tip and lay it right over one of those little slots and just roll it back and forth with your fingertips, and it'll go right in there and stay.
Okay.
Okay. When you're finished, we're going to throw away this plastic covering, and all you're going to have is the 4 Q-tips open and exposed to the air, laying in the holder just like they are in the picture.
Okay.
Okay. And then when you're finished doing that, we're going to close it up, place it inside of the envelope, remove this strip, seal it, and hand it back to me. And
Cool.
we'll be all done.
All right.
Chastity, you want to go first?
Sure.
You want to swab up and down as though you're brushing your teeth.
Okay.
Okay, just put it in and pull it away.
Pull your trick out.
Away, yes. Just so that's only so you're putting pressure on the inside of your cheek, so we get a lot of cheek cells.
Oh, okay.
Okay.
All right. Ready?
You guys go first. I'll get you.
Let's do it. Hot. Huh? Mine's not going in. Come on, little guy. All right.
Sometimes you have to separate it with your fingers. Yeah. Sometimes it gets squashed up in shipment.
Oh, that's pretty.
We love you, Jayden.
All right, let's cross our fingers.
Yay!
Okay.
Welcome back, and as you can see on the video, it is really easy to get tested, and just imagine, you could save somebody's life.
That's right. There are a couple different ways, a couple different websites actually that you can go to, and you can get home kits. They send you these kits with the cotton swabs to your house. You do them, and then you send it back in. You don't have to give blood right away. It's very, very easy to see if you are a match for somebody who desperately needs your help. So Gianna and I are going to do a couple of things. We're going to set up an online drive specifically for Jayden. We'll be giving you that link as well in the next month or so. We also want to do a physical drive. If you're in the Bay Area, we'll give you updates on that. There are lots of different ways to help, and also I wanted to mention, if you're not into the donor thing, it's not for everyone. Maybe just give money. They do need money.
They do.
Every person that becomes a donor, it takes about $100 to process them into the registry. So they need funds. So if you can give that way too, and it doesn't have to be a lot. Just anything you can do would definitely help.
And it is a big decision. So
Yeah.
if you do make that step, you have no idea how much your kindness is appreciated, not by just myself and our family, but by anyone else out there who is possibly in need of a donor.
That's right. So keep up to date with us. We'll give you all of our decisions we make with our drives, and hopefully you'll help out. And if you do, let us know. Let us know what you're doing to help too.
And check out the website, candodivas.com. We'll have all the information posted there. Thank you, everyone, and happy health.